Hello, on behalf of my colleagues in the Chongqing Medical University, I'm here presenting the study took place in Chongqing, China. The study is about using shear wave electrography in monitoring tips function. It's not working. It's not working. Oh, transjugular intrahepatic portal systemic shunt tips is used in management of late stage of liver disease with severe portal hypertension. The development of a TIPS dysfunction rate is pretty high. As reported, about 40 to 60% patients with TIPS developed TIPS dysfunction in 2 years after TIPS placement. So it is very important to have a non-invasive technique to monitor TIPS function to reduce the use of invasive tests and the high-cost MRI. You may see this is show the tips. This tips drains the portal blood to systemic venous system to reduce the pressure in the portal vein. And this is a portal venogram. You can see the tips. This is a color Doppler ultrasound. Hypothesis: spleen stiffness increases resulting from hyperdynamic circulation and hyperplasia in the spleen in the patient with portal hypertension. And the shear wave propagates fast in stiff biological tissue than soft tissue. So the hypothesis of the study was to use shear wave velocity to estimate the change of spleen stiffness following the change of portal vein pressure associated with TIPS function. This is a small pilot study, and the preliminary study was published in 2012, and that time the study was observed the patient before and after TIPS placement. This one, the purpose of this study is to validate the shear wave velocity in assessment of spleen stiffness before and after TIPS procedures, including preliminary placement and revision. Second, to evaluate the capability for spleen stiffness in determining TIPS dysfunction, and also to compare the effectiveness of shear wave velocity with conventional splenoportal venous velocity on the regular Doppler, spectral Doppler, in monitoring TIPS function. Study we used a Siemens S2000 ultrasound scanner equipped with a 4C1 curvilinear transducer. Spleen, shear wave velocity and the splenoportal venous velocities were measured in 33 patients before and 3 days, 3 months, 6 months, up to 12 months after primary TIPS placement, or patient developed TIPS dysfunction. And those measurements also obtained from 10 patients before and after 3 days after TIPS revision because of their TIPS dysfunction. And TIPS dysfunction was diagnosed by color Doppler imaging and clinical information. You may see this is a TIPS dysfunction. This one is a TIPS. In the diagnosis, the TIPS dysfunction including direct indication and indirect indication. Direct indication in TIPS occlusion that shows no intra-TIPS flow on color or spectral Doppler. And stenosis you can see increased intertip flow velocity greater than 200 centimeters per second, very fast flow. Indirect indications, most likely more clinical information like increased ascites, increased splenomegaly, recurrent variceal bleeding, and on Doppler you can see decreased portal vein velocity. And the images show this higher intra-tips velocity. So in the portal venogram, and see the tips occlusion, no contrast media through the tips. And after tips revision, you can see contrast media go through the tips. During the study, using portal systemic pressure gradient as a reference, also it's not very accurate, but still, this technique still considers the golden standard in the clinical services. Spleen shear wave velocity measurement. We did 9 spleen shear wave in the 3 regions, 9 measurements. The region size of a region of interest is 10 times 5 millimeters. Location is 2 centimeters deep from the spleen capsule. Success rate is greater than 60%. And May portal vein and splenic vein Doppler velocity measured 3 times in each vessel with a Doppler angle correction less than 60 degrees. Here is a spleen shear wave velocity measurement. This is a before tips revision. You can see the 3.5 meters per second. And the same location, measure the after tips revision, and the velocity down to 2.5 meters per second. The sequence is very obvious. The Doppler ultrasound, you can see before and after tips placement and the revision. Before tips placement and revision, the velocity very low in the main portal vein. After tips procedure and hypertension, portal hypertension is improved, and the portal vein velocity is increased. The result, 33 patients underwent both preliminary tips placement and the portal systemic collateral varices embolization because of hypertension. This study may be a little bit different from reported studies. And during 12 months follow-up, 23 of 33 patients had functioning tips up to 12 months. However, 10 patients developed tips of dysfunction and are treated by tips revision. Only one patient, it is need to know the one patient follow-up 12 months after primary tips placement. However, 9 patients developed the tips dysfunction less than 4 months after tips placement. You may see the different parameters. And we measure, actually, the investigators measure the spleen shear wave velocity with 2 ways. One with a median interquartile range, the other one with a mean and standard deviation. But this reported, you can see pre-tips, post, pre and after placement and the revision. You can see the significant difference between 2. Another analysis uses the mean and standard deviation. This is a reference gradient. This is a spleen shear wave velocity measurements. This is a Doppler spleen and the portal vein measurements. All measurements, thickness difference in all 4 parameters before and after tips placement and before after tips revision. And also notice there was no significant difference between user mean and standard deviation and the user median in interquartile range. Box plot show also the same result before and after tips procedures. And this figure shows 23 tips, functioning tips. You can see after 12 months, still stable, the measurements, spleen vein velocity. And one case with tips occlusion, you can see the velocity decrease significantly. And this one shows the spleen shear wave velocity. You can see the 12-3 functioning tips. The shear wave velocity is stable, pretty good. And the one case with tips occlusion, because recurrent portal hypertension and the spleen shear velocity increased tremendously. So area under RC curve for 3 parameters, portal vein velocity, splenic vein velocity, and spleen shear wave velocity, there was no significant difference among 3 methods. This showed area under RC curve very much similar, sensitivity and specificity. Discussion, the positive correlation between spleen stiffness and the portal vein pressure, negative correlation between Doppler velocity and the portal vein pressure. So portal vein velocity increases after tips placement, revision, and decreases when tips failed. The same thing, spleen shear velocity decreases after tips placement, revision, and increases when tips failed, occlusion or stenosis. So our results suggest that spleen stiffness estimated by shear wave velocity is compatible with Doppler method in monitoring tips function. Spleen shear wave velocity can be used as a quantitative marker in determining, or semi-quantitative marker in determining tips of dysfunction. Further study is warranted. Thank you very much.